Hold out your hand for a second. Press down firmly on one of your fingernails for 2 full seconds, then let go and watch how fast the color comes back. That small test, the one you just did without any equipment, is something cardiologists actually use at the bedside to check circulation in seconds. And it's only one of 4 visible signs on your nails that can quietly point to what's happening inside your heart and blood vessels, long before any dramatic symptom shows up. Your nails are not just something you trim once a week. They're a living record of what your cardiovascular system is doing every single day. The trouble is, almost nobody is ever taught how to read that record. And after 60, when heart and vessel problems tend to build slowly and silently rather than announce themselves with chest pain, these small visible signals become one of the few early warning systems you can check yourself, for free, in under a minute. I'm Dr. James Revealio, and for more than 2 decades, my focus has been preventative health for adults over 60. Today, I want to walk you through 4 specific nail signs that medical research has linked to elevated risk for heart attack, stroke, and circulation problems that often go undiagnosed for years. The 4th one is the sign I most want you to remember, because it's the one almost no one has ever been told to look for. Before we go further, drop your age in the comments and let me know if anyone in your family has ever had a heart attack or a stroke. Your answer matters, because family history changes how seriously you should take everything we're about to cover. And if you find this useful, a quick like genuinely helps this channel reach more people who need it. Why your nails know before your doctor does. To understand why these 4 signs matter so much after 60, it helps to know a little about what's actually happening beneath your nail. Every nail grows out of a structure called the nail matrix, a thin layer of living, active cells just beneath the base of the nail. Those cells sit in direct contact with your bloodstream, and they respond to changes in oxygen levels, circulation quality, and the condition of the smallest blood vessels in your body. The capillaries under your nail bed are some of the tiniest vessels you have. Because they're so small and so close to the surface, they're often the very first place cardiovascular strain becomes visible, well before it shows up anywhere else. In your 30s or 40s, your heart and vessels have enormous reserve capacity. The body can mask early dysfunction for years without a single outward sign. But past 60, that reserve narrows. Not because anything is broken, but because 6 decades of steady use naturally shrink the margin for quiet problems to hide in. Think of your nail bed as a small window into your smallest blood vessels. When those vessels start to struggle, the nails are frequently the first place that struggle becomes visible to the naked eye. It's also worth understanding why your own doctor may never have mentioned any of this. A typical appointment runs about 15 minutes, and unless something on your nails looks visually alarming, a detailed nail exam rarely makes the priority list. The information exists in the medical literature. It just doesn't always make the short trip from a textbook to the person sitting in the exam room. So let's close that gap. Here are the 4 signs, one at a time. Stay with me through all 4, because the last one is the one almost nobody has ever been taught to check. Sign 1, cyanosis. And the distinction that changes everything. The first sign is a color change called cyanosis, a bluish or purplish tint visible through the nail, usually concentrated near the base. Most people have never been taught that there are 2 very different kinds of cyanosis, and knowing the difference changes how urgently you should act. Peripheral cyanosis shows up only in the fingernails and sometimes the toenails. Your lips, tongue, and the inside of your mouth stay a normal pink. This kind tends to develop gradually, over weeks or months, and it's your body signaling that circulation to the extremities isn't what it used to be. It's a warning sign, not an emergency. Central cyanosis is different, and it's serious. Here, the bluish tint appears not only on the nails, but also on the lips, tongue, and inside of the mouth. This is a medical emergency. It means the blood leaving your heart isn't carrying enough oxygen, and it calls for immediate medical attention, not a wait-and-see approach. In both cases, the underlying issue is the same. The tissue isn't getting enough oxygenated blood. With peripheral cyanosis, the problem usually lies in circulation. With central cyanosis, it usually lies with the heart or lungs themselves. Medical research has repeatedly connected persistent peripheral nail bed cyanosis with early-stage heart failure, undiagnosed valve problems, and chronic lung disease that eventually places strain on the heart. This matters enormously for people over 60 because heart failure becomes far more common with age and remains one of the most underdiagnosed conditions in older adults. Early heart failure rarely announces itself with chest pain or collapse. It's usually a slow, quiet decline in efficiency that the body compensates for, right up until it can't anymore. Picture a retired postal worker. We'll call him Frank, who noticed for nearly a year that his nails looked slightly purplish at the base, especially in the mornings. He chalked it up to cold weather and just getting older. It wasn't until his daughter visited and pointed it out that Frank mentioned it at his next checkup. His doctor ordered an echocardiogram and caught early-stage heart failure, still highly manageable with medication and lifestyle changes. That one comment, prompted by a color he'd been dismissing for months, likely spared him a hospitalization. What to do? Examine your nails in good natural daylight, ideally near a window. If the base of the nail bed looks bluish or purplish and doesn't change once your hands warm up, mention it to your doctor and ask specifically whether an echocardiogram makes sense given your age and risk factors. And if you ever notice a bluish tint on your lips or tongue along with your nails, don't wait for an appointment. Treat it as an emergency. Have you ever noticed a color change in your own nails? Type heart in the comments if you'd like a full deep dive on heart failure warning signs you can spot at home. Sign 2. Brittle, slow-growing nails. The second sign is one nearly everyone over 60 waves off as just aging. Nails that break easily, peel in layers, split vertically, or seem to barely grow month to month, where you once trimmed them every 2 weeks and now they hardly change. What's actually happening is that the nail matrix isn't receiving the steady, nutrient-rich, oxygenated blood supply it needs to build healthy new tissue. One of the most common culprits in older adults is peripheral artery disease, or PAD, narrowing of the arteries that supply blood to the arms, legs, and hands caused by plaque buildup. Here's the part almost nobody is told. The same kind of plaque that triggers heart attacks in the heart's arteries and strokes in the arteries feeding the brain is the same plaque that narrows the small arteries feeding your fingertips. Plaque in one place is a strong signal that plaque is forming elsewhere too, which is exactly why PAD is considered one of the strongest predictors of future heart attack and stroke. People diagnosed with PAD carry a meaningfully elevated risk of major cardiovascular events compared with those who don't have it. PAD is also often silent for years, but there's a pattern of 3 signs that, together, are far more telling than any one alone: brittle, slow-growing nails, hands and feet that stay cold and take a long time to warm up, and cramping or heaviness in the legs when walking, especially uphill or upstairs. That eases with rest. That last symptom has a name: claudication, and it's one of the most reliable clinical clues to significant arterial narrowing. Consider a lifelong gardener, call her Eleanor, whose nails began splitting and turning brittle in her late 60s. She blamed years of working in soil and harsh winters, tried strengthening treatments, and got nowhere. What finally prompted a closer look was an offhand comment at a routine visit. Her legs felt heavy walking uphill, a feeling that had crept in over about a year and a half. Her doctor ran a simple ankle brachial index test, comparing blood pressure at the ankle to blood pressure at the arm, and confirmed moderate PAD. With a structured walking program and the right medications, she cut her cardiovascular risk dramatically. Her nails had been telling that story for nearly 2 years before anyone connected the dots. What to do if your nails have grown noticeably more brittle over the past year or two, and you notice heaviness, cramping, or fatigue in your legs when walking uphill or upstairs? Ask your doctor specifically about an ankle brachial index test. It's simple, non-invasive, and can catch PAD at a stage where treatment makes a real difference. Sign 3. The capillary refill test. This is the one I asked you to try at the very start, and I want you to do it again with me now. It takes less than 5 seconds. Hold your hand at heart level. Choose a nail. The index finger works well. Press down firmly on it with your other thumb for about 2 seconds. You'll see the nail bed turn white as blood is pushed out of the capillaries underneath. Now release and start counting. 1 1,000, 2 1,000. Watch how fast the pink returns. In a healthy adult with good circulation, color typically returns in under 2 seconds. If it consistently takes 3 seconds or longer, especially across several fingers, that's a sign the smallest vessels in your body aren't refilling the way they should. A second, complementary check. Press the back of your hand against your forehead or cheek. It should feel close to the same temperature as your face. If your hands consistently feel noticeably cooler, even in a warm room, that's another marker of reduced peripheral circulation. Doing both checks together paints a fuller picture than either alone. What you're really measuring with the refill test is how quickly your microvascular system, the network of your very smallest vessels, recovers from pressure. A sluggish refill means sluggish circulation in those small vessels, and research has linked persistently slow capillary refill in adults over 60 to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. The microvascular system often shows trouble first, simply because it has the least reserve. One caution before you worry: a borderline result of 2 to 3 seconds isn't automatically alarming, especially with cold hands or certain medications. Some blood pressure drugs and beta blockers can slow refill slightly without indicating a problem. Retest in a warm room with warm hands. If it's still consistently 3 seconds or longer across multiple fingers, that's when it's worth paying attention to. Take a retired postal worker named Walter, who tried this test on a whim after seeing it mentioned on a health program. He counted nearly 5 seconds before color returned. On his index finger, his thumb, his other hand, the result was the same each time. He called his doctor the next morning, described what he'd found, and a full cardiovascular workup uncovered undiagnosed atrial fibrillation, a heart rhythm problem and one of the leading causes of stroke in older adults. Appropriate treatment likely prevented a major stroke in the following year. What to do? Try the test right now on at least 3 fingers, in a warm room with warm hands. If your refill consistently runs 3 seconds or longer, write it down and bring it to your next appointment. Ask specifically whether a cardiovascular evaluation, an EKG, and possibly an echocardiogram would be appropriate. Tell me in the comments how many seconds your refill took. I read every reply. Sign 4. Changes to the lunula. The one almost no one knows. This is the sign I saved for last, because it deserves it. Look at the base of your nail, just above the cuticle. Do you see a small, pale, half-moon shape? That's called the lunula, and it's the visible portion of the nail matrix, the exact spot where new nail tissue is being formed in real time. It's also one of the most overlooked visible signals in the entire body. Here's something rarely explained. Which fingers show a visible lunula matters as much as whether one is there at all. In most healthy adults, the thumb and index finger almost always show a clear lunula. The middle finger usually does too. The ring finger sometimes does, and the pinky often doesn't. And that pattern alone is completely normal. So if your pinky has no visible lunula, but your other fingers do, that's nothing to worry about. What's worth noticing is when the pattern changes. When a lunula that used to be visible on your thumb or index finger disappears, when lunulas across most fingers become faint, or when the color shifts away from its normal pale white. Each color shift tends to point in a different direction. A reddish lunula has been associated in clinical observations with congestive heart failure and certain rheumatic heart conditions. A bluish lunula points toward the same oxygen and circulation issues we covered with cyanosis. A very pale lunula that seems to fade into the surrounding nail can be a marker of anemia, which carries its own significant connection to cardiovascular strain. Consider a 72-year-old grandmother, call her Dorothy, generally healthy her whole life, who mentioned almost as a joke to her nurse daughter that the little white half-moons on her nails seemed to have vanished. She couldn't recall when she'd last seen them. Encouraged to bring it up at her next physical, she did, reluctantly, feeling silly about it. Her doctor took it seriously, ordered a complete blood count and a cardiovascular risk assessment, and found meaningful anemia that had been developing slowly, along with early signs of cardiac strain. Both were caught and addressed before progressing further. The change in her lunula was the first visible clue, and it might easily have gone unnoticed for another 2 or 3 years. What to do? Look at your thumbs and index fingers under good natural light. If your lunulas have largely disappeared, shrunk noticeably over recent years, or changed color, bring it up at your next appointment and ask specifically for a complete blood count and a cardiovascular risk assessment. Putting it all together knowing something and acting on it are 2 different things, so let's close that gap. Start today. Take both hands to a window with good natural daylight. Check the color of each nail bed for any bluish or purplish tint. Note whether your nails feel brittle or seem to be growing more slowly than before. Run the capillary refill test on at least 3 fingers and time it. Look at the base of each nail for the lunula and note which fingers show one and which don't. Take a photo of both hands. A visual record makes it far easier to track gradual change than memory alone. If anything we covered today matches what you see, write it down. The specific sign, which finger, and roughly how long you've noticed it. Bring that note to your next appointment. And if you notice 2 or more of these signs together within the next month, don't wait for your annual physical. Call your doctor's office, describe exactly what you've observed, and ask whether a nurse can help triage whether you should be seen sooner. One important note: please don't diagnose yourself from any single sign in isolation. What matters is the complete clinical picture: your history, your medications, your other symptoms, and what your doctor finds on examination. The goal of everything we've covered today is to make you a better informed participant in that conversation, not a replacement for it. Here's what I want you to take with you. Your body has been communicating with you your entire life, sending signals, some loud, some quiet, every single day. And the truth about your 60s, 70s, and beyond is that this is not a stage where meaningful change becomes impossible. Early attention to signals like these can genuinely change outcomes, even later in life. The nails you glanced at this morning and may have dismissed as unremarkable could be the most accessible diagnostic window your body has ever offered you. Now you know how to read it. If this video helped you, subscribe to Science of Wellness so you don't miss what's coming next. And if someone you love could benefit from these 4 signs, a spouse, a sibling, a friend, share this with them. The next person you send it to might be the one who notices something on their own hands tonight. I'll see you in the next one.